Hi, this is Dr. Albert Nejat. Today we'll be discussing the diabetic foot. The American Diabetes Association and the American Podiatric Medical Association both recommend yearly visits to the foot specialist by the diabetic. These visits should be done whether there are any problems noted or not. Number one problem is loss of protective sensation. If you can't feel your feet, you don't know what's wrong. With diabetics, this loss of sensation can make smaller problems, smaller irritations, small wounds progress into larger wounds. The second problem is poor circulation. Lots of diabetics have a decreased blood flow to their feet. So their blood flow, which would normally carry nutrients down to the feet in order to heal smaller wounds, it's not adequate enough. So these smaller wounds can progress to major, larger wounds. And the third problem is the immunosuppression that most diabetics have. Their inability to fight small infections. These small infections can progress to larger problems. So a diabetic who can't feel their foot gets a smaller irritation. The irritation continues to grow because they can't feel it and they can't tend to it. Their poor circulation will prevent this smaller wound from healing in time, and their immune suppression can prevent them from healing a small little infection. So these little small infections become bigger and bigger. This is why diabetics are still the #1 population for amputations in America. Over the last 10 to 15 years, we've done a great job of reducing these numbers of amputations in the U.S. However, these numbers are still outstanding. So we need to make sure that you're checking your feet. You're checking your feet on a daily basis, making sure your shoes are adequately fitted. These shoes are adequate in protecting your feet. And make sure that you don't have these irritations that we were talking about. Some of these common foot problems like bunions and hammer toes. If you're wearing a snug shoe and you can't feel the irritation from the shoe, can cause open wounds, and these open wounds can progress to unfortunate infections and amputations. This is Dr. Albert Nejat from Los Angeles, California. If you have any further questions or any suggestions for informational videos, please contact us through the website albertnejat.com, albertnejat.com. Thank you very much.